Did you know that some of the most dangerous risks to a baby during pregnancy aren't always visible? Many infections cause mild symptoms in adults, or sometimes no symptoms at all, but during pregnancy they can occasionally have serious consequences for an unborn baby. The good news is that serious infections in pregnancy are relatively uncommon, and being informed can help you reduce your risk and know when to seek advice. Today, I'm going to explain 5 important infections every pregnant woman should know about. First is toxoplasmosis. Toxoplasmosis is caused by a parasite that can be found in raw or undercooked meat, unwashed fruit and vegetables, contaminated soil, and cat feces. Many people never realize they've been infected because symptoms are often mild or absent. However, if contracted during pregnancy, toxoplasmosis can sometimes affect a baby's brain, eyes, and nervous system. To help reduce the risk, cook meat thoroughly, wash fruit and vegetables before eating, wear gloves when gardening, wash your hands after handling raw meat or soil. Next is Listeria. Listeria is a type of bacteria that can contaminate certain foods. Foods that may carry a higher risk include unpasteurized milk and dairy products, certain soft cheeses, chilled ready-to-eat foods, smoked fish, pre-packed sandwiches that have been stored for long periods. In pregnancy, Listeria infection can increase the risk of miscarriage, stillbirth, premature birth, or serious infection in newborn babies. One infection many people have never heard of is cytomegalovirus, often called CMV. CMV is actually one of the most common infections passed from mother to baby during pregnancy. The virus is commonly spread through contact with the saliva or urine of young children. Most adults have no symptoms at all and often don't realize they've been infected. However, in some cases, congenital CMV can affect a baby's hearing, vision, growth, or development. Simple ways to reduce the risk include washing your hands after changing nappies, avoiding sharing food, drinks, or cutlery with young children, avoiding kissing young children on the lips. This is why pregnant women are advised to avoid certain high-risk foods and follow food safety guidance. Another important infection to be aware of is group B Strep, often called GBS. GBS is a bacteria naturally carried by many healthy adults and usually causes no symptoms. Many women will carry GBS without ever knowing it's there. While it is usually harmless to the mother, it can occasionally cause serious infection in newborn babies around the time of birth. This is why maternity teams assess individual risk factors during pregnancy and labor and may recommend antibiotics during labor for some women. Finally, there's Parvovirus B19, often known as slapped cheek syndrome. In children, this infection usually causes a mild illness with a distinctive red rash on the cheeks. However, if contracted during pregnancy, it can occasionally affect a baby's red blood cells and may require additional monitoring. If you have been in close contact with someone who has slapped cheek syndrome while pregnant, contact your midwife or maternity unit for advice. The good news is that most pregnancies are completely healthy, and serious infections remain relatively uncommon. Awareness isn't about creating fear. It's about helping you make informed choices, reducing your risks where possible, and knowing when to seek advice. If you think you may have been exposed to an infection during pregnancy, or you're feeling unwell, always contact your GP, midwife, maternity triage, or healthcare provider. For trusted pregnancy information, visit these websites. Follow Midwife Moments for evidence-based pregnancy education that helps you feel calm, informed, and confident during pregnancy and birth.